Hello everyone, welcome to this episode. In this episode, we want to talk about insomnia. So, insomnia is a type of sleep disorder in which people have difficulty falling asleep or difficulty staying asleep. So, the question then is, why do we have difficulties falling asleep or difficulty staying asleep? And how does this affect our health? And then also, what can we do to prevent or treat these difficulties that we have in falling asleep or staying asleep? Subscribe to this channel, comment, like, and share. There are so many reasons why people have difficulty falling asleep or staying asleep. Some common causes include lack of or insufficient amounts of exercise or physical activity. Again, sleeping in a room that is too hot or too cold can also cause problems in sleeping. And also, sleeping in a bed that is uncomfortable can also be the reason why people have difficulties falling asleep or staying asleep. In addition to what we've already discussed, there are some mental health conditions which research has shown to be the possible reasons why people have difficulty falling asleep. Some of these mental health conditions include depression, anxiety, stressful life events, bipolar disorder, and schizophrenia. Substance use or the excessive intake of alcohol and smoking has also been known as one of the possible causes for sleep difficulties. Other health problems which have been shown to be the underlying causes of sleep difficulties includes obesity, which is the gain of excess weight, diabetes, and memory problems. Heart disease, arthritis or back pain, and menopause are other known causes of sleep difficulties. Studies have shown that certain medications or the intake of certain medications may also lead to difficulties in sleeping or difficulties in staying asleep. So, medications for colds, allergies, depression, high blood pressure, and asthma may lead to difficulties in falling asleep or staying asleep. The effects of sleep difficulties on our health has been widely reported. Sleep difficulties are known to lead to mental health problems such as depression, anxiety, and memory problems. Again, sleep difficulties are also known to increase the risk of developing stroke, asthma, and a weaker immune system. The difficulty of falling asleep or staying asleep may also result in other health conditions such as obesity, which is the gain of excess weight, diabetes, heart disease, and high blood pressure. So the next question that we want to answer is, what can we do to prevent sleep difficulties, or what can we do to overcome sleep difficulties? One of the things that we can do to overcome sleep difficulties is that we need to change our sleep habits. This means that, for example, we need to go to bed and wake up at the same times every day in order to establish a sleep routine. So, another sleep habit that we need to change in order to improve our sleep is that we need to avoid using any devices with screens before bed. This will mean that we need to keep our mobile phones and also televisions outside of the bedroom to prevent them from disrupting our sleep. Another thing we can do in order to improve our sleep quality is to make sure that our rooms are not too hot or too cold before bedtime. If we want to be able to overcome our sleep difficulties, then we need to check the way we eat. One of the things that we need to do is to avoid going to bed hungry. Hunger can make it difficult for you to sleep, and hunger can keep you awake. Again, as far as our diet is concerned, we need to avoid eating a heavy meal within 2 to 3 hours before bed. Moreover, if we want to be able to improve our sleep, then we need to avoid beverages which are high in caffeine and also avoid the intake of alcohol just before bedtime. Again, eating a balanced diet can help to improve overall health and therefore help to improve sleep quality. It is important that we exercise regularly if we want to be able to overcome sleep difficulties. However, this exercise should be done during the day and not just before bedtime. Exercising just before bedtime has been shown to cause sleep difficulties. Engaging in relaxation Techniques such as progressive muscle relaxation before sleeping has also been shown to improve sleep quality. We also need to avoid taking naps during the day since this can make it difficult for us to sleep at night. Finally, if we want to be able to overcome sleep difficulties, it is important that we seek medical attention from an expert such as a psychologist for mental health conditions such as depression, anxiety, and stress. Depression, anxiety, and stress have been shown to be among the main underlying causes for sleep difficulties. Don't forget to subscribe to this channel, comment, like, and share.